Sam, would you like to take it away?
Yeah, I'll share my
your
screen. Okay, thank you, Jen, for introducing me. My name's Sam. I'm Health and Wellbeing Consultant with Westfield Health, and I'm going to talk to you about your chamber cash plan and anything else that we do in regards to health and wellbeing that might support you and your business. So I just wanted to share some key facts from our report that we did in November 2020 and January 2021. So key findings that mental health increased days off that we were seeing within the workforce by 10%. So that's quite a lot. And I know that this is during the pandemic, but this gives us a good idea of what was happening with people's overall health and well-being. A third of employees reported that they had poor mental health within the workplace, so within their organisation. And 36% of employees said that their mental health was affecting their productivity on a weekly basis. And I know that this report was done last year, but we are still seeing these trends today in regards to productivity and mental health, as well as mental health days. Employees reported significantly lower levels of morale, well-being and productivity compared to HR leaders. And what that shows us is that employees were struggling with the day-to-day activities, whereas the HR leaders or management were not necessarily seeing this impact on their people. 81% of HR leaders said that the pandemic has increased their wellbeing focus, which is great news. We want that to happen, and we would like that obviously to be 100%, but at least we're getting a good amount of people, an amount of HR leaders that are taking wellbeing into account. 24% of workforce is looking for extra wellbeing support from their employer in the coming months. And that's a trend that, again, we're still seeing now. So we're still seeing workforce and people wanting health and wellbeing within their business. So I wanted to share those stats with you first so I can move into what a cash plan is and also how a cash plan can help you with your wellbeing journey, but also to help your people on theirs as well. So I've got a short video to show you, which is explaining what a healthcare cash plan is, but more specifically, I will be going into detail about what the chamber cash plan is and how you can go about using it.
Now you've got a health cash plan from Westfield Health, we want to help you make the most of it. All our plans are different, so have a look in your plan guide to see exactly what you're covered for. As well as claiming money back on everyday healthcare expenses, you can get cash payouts for hospital stays or when you welcome a new member of the family into the world. Your plan may also include valuable health and well-being services. Things like gym discounts, a 24-hour advice and information line, and telephone access to qualified GPs. It's all part of our commitment to keeping you at your healthy best. And that's not all. Did you know your cover also gives you access to discounts, cashback and savings at hundreds of leading retailers and leisure brands via Westfield Rewards? You'll be surprised how much you could save. And when you're ready to make a claim, it's easy. Just follow these 3 simple steps. Step 1. Go for treatment, pay as normal and keep your receipt. Step 2. Submit your claim within 13 weeks, either online or by post. Step 3. We pay your money straight into your bank account. It's as simple as that. And remember, you can log into My Westfield at any time to view information about your cover or ring our friendly customer care team on 01 14 250 2000.
So in regards to the key features of the cash plan, so we're talking now specifically about the chamber cash plan. There's no medical required to join. The premium does not increase with age, so we've made sure that this is an inclusive plan. So regardless of the age of your workforce, the premium will not increase as they get older. You get 100% of the reimbursement up to the set limits on the cash benefit, and there's no limit on the number of claims that you can make as long as you don't go over the limit. Pre-existing medical conditions are covered for all eligible employees. It does say in brackets there except personal accident, but I can explain that in a little bit more detail. And worldwide cover is available on most of the benefits that we provide you as well. So this is what the plan looks like. So you've got 4 levels of cover, level 1, 2, 3 and 4. The red dot is saying 100. I can't quite see it on this screen, but it does. It says 100, and that means that you have 100% of the reimbursement on the cash benefits up to the limit that you are on for your level. And the 1 year in the blue means that you have that entitlement for the year. So for example, if you were on level 4 for optical, you would have £220 to use for the year. At renewal, you replenish the allowances again, so you have your full pot again for the next 12 months. So just going down the benefits, so you have your payback ones, which are the ones that you can claim money back on. So you have your optical, dental accident, chiropody, therapy treatments, which include physiotherapy, acupuncture, chiropractor, homeopath and osteopath, and consultation. The consultation is private, as is the other services. So you can choose whether you want to go to an NHS opticians or a dentist or a private dentist. You can select from the local high street opticians or a more private opticians. You can use any chiropodist and any therapy treatments as well. Within regards to the therapy treatments, the only thing that we stipulate is that you use an approved practitioner. And an approved practitioner means that you're using someone who's part of the regulating council. And that's just to ensure that you're taking care of yourself by seeing the correct people with the correct qualifications to have your treatment. You also have Westfield Rewards on there as well, which is an online and high street retail platform, giving you access to a wide variety of discounts ranging from your utility bills to your grocery shops to away days. There's hundreds of discounts on there, both online and in the physical shops as well. So we'll move down to the health and wellbeing services. So you get scanning services, so MRI scans, CT scans and PET scans. So you are entitled to have as many MRIs and CT scans as you need in a consecutive 12 months. You can only have 1 PET scan a year though, just purely because of what's involved with that scan. You get Dr. Line. Dr. Line is a 24/7 GP surgery, and that is available to you and the family that you live with as well, regardless of age. So they can also utilise Dr. Line. They can do prescriptions, they can do telephone appointments, they can do web appointments, they can speak in English or they can speak in a different language depending on what you need. You can also state whether you want them a male or a female GP as well. Dr. Line is another benefit available on this cash plan. Again, that is for you and your family regardless of their age. This is a dedicated second opinion service. So if you have an ongoing medical condition or you've had a diagnosis, or you may not have even had a diagnosis yet, but you just want that second opinion, Best Doctors is the service that you would need to contact. We also inbuild our EAPs into the cash plan. So an EAP is an employee assistance program. So it's a 24/7 advice and information helpline. This also comes with Health eHub. So this telephone line can be used by you and your family who are over the age of 18. And it can be for any legal support that you might need. It can be for health and wellbeing. So we have a team of nurses available as well. Or it can be for counselling, so we have a team of counsellors supporting that telephone line too. You as a policyholder can take advantage of structured counselling, so you could have up to 6 structured counselling in a consecutive 12 months. You also get gym discount. So gym discount is a gym platform. So you go onto the gym discount page and you pop in your postcode and it will bring you a result of all gyms within your postal code offering some form of discount. But not only that, they offer online platforms too. So the likes of Les Mills On Demand is on there. There's lots of yoga platforms on there, Pilates platforms. They keep on adding on to it. So they now have apparel. So they have clothing, gym water bottles, towels, etc. So they're all available as well. And you also get personal accident, accidental death, and personal accident permanent disability benefits on there as well. So this isn't a death in service because it covers you 24/7, and it covers you if you have sadly passed away as the result of an accident and a payout would be made, or if you receive a permanent disability as a result of an accident, again, a payout would be made. So just to reiterate, there's 4 levels of cover to choose from: level 1, 2, 3, and 4. You can stagger the levels through your business. So if you have a business that's got a few different levels of employee status, whether you want management included on a higher level, whether or not you want them to be included in a higher level to show the support for long-standing staff members, that can be done as well. But this is a really popular cash plan, and it's only available to chamber members. We work with the British Chamber of Commerce, so we are the health and wellbeing provider for the British Chamber of Commerce, and then all of the affiliated chambers that are associated with the BCC. So this means that this cash plan is not available to anyone outside of the chambers. This is only for chamber members, and you can take advantage of this.
Sam, can I just quickly ask, for the different levels, what's the cost per month for the different levels?
I can go into that towards the end of the presentation. I've got that on another screen, but that they start at £6.13 for level 1, and then they increase. Obviously, level 2 will be higher, level 3 higher still, level 4 would be the top level. But I can tell you the prices towards the end of the presentation.
Perfect, thank you.
So you can also cover children as well. So you can choose as a business to pay for your employees' children. That would be 36p per employee per month. Or you can have your employees pay for their own, which would be 77p per month. They get their own pot of money separate from yours, but their pot will be split between the dependent children. The same rules apply. They get 100% of the reimbursement for a year, and obviously which would then be replenished upon renewal. So we also offer other forms of health and wellbeing as opposed to just the cash plan. So if you wanted to create a little bit more of a package, you could think about adding our private health insurance. So our private health insurance is very different to the other health insurance providers out there, because we do not include cancer and we do not include heart conditions within our health insurance, which means that we can drastically lower the premiums to the business, but still giving you a great level of service. So our PHI is called Surgery Choices. We have 2 levels, Surgery Choices 1 and Surgery Choices 2. And how that works is that it gives you access to operations that the NHS class as non-urgent. I don't like saying non-urgent because if you are struggling with one of these issues, it's going to be a very urgent issue for you. But to give you an example of a few of the operations that would be considered is hip replacements, knee replacements, tonsillectomies, things like that. So level 1 covers over 60 of the most common non-urgent operations, and level 2 covers over 1,000. You'll get everything included, so your hospital treatment, your operation, your aftercare will be included on that as well. But it just removes certain things that would bump up the price for you. So again, this is giving you a little bit of an example of the private health insurance. So employees benefits, the employer benefits, sorry, your staff get treated sooner and they get back to work quicker. So the way that the PHI works quite nicely with the cash plan is that you have your consultation benefit on your cash plan. So an employee will go and have their consultation via the cash plan, and they'll also have their scan on the cash plan as well. And if it's then determined that an operation is required, they can go over to the PHI, the health insurance. The cover is affordable, so we have 2 levels, and both of these levels are under £20 per person per month. There is again one price for all, so we do not increase premiums because of age, and we don't increase the premiums because of the claims either. It's really easy to set up the policy, just like the cash plan. It's really straightforward. And again, you can have the different levels for the different staff levels if you wanted to. And this just gives an example of the employee benefits as well. So the employees receive prompt access to private health insurance treatment. It is non-urgent surgical and medical procedures. But again, if you're suffering with one of those, you want it done quickly. Also, from the employer's point of view, you would want the employee to have that surgery quickly as well, because things like knee replacements, they can be impacting against the business if an employee can't come into work. You're not bound by any specific hospital. You can choose any hospital of your choice. You'll work with one of the PHI clinicians who will help source the hospital for you and give you a list of the hospitals that you can choose from. Now, there's also the option of going on NHS as well. So if you have the private health insurance for your staff and they have an opening for the operation to be done quite quickly on the NHS, the employee might choose to stay and have their treatment on the NHS. And if that is the case, then Westfield would make a payout to either you as the business or the employee. Again, there's no medical required, and there's actually no excess to pay for the PHI as well. So that's our insurance side, but we actually do a lot more in regards to health and wellbeing alternatives as well. And I'm just going to go through some of those. So we do something called Ease, which is our standalone EAP telephone line. So if you didn't want the cash plan, we do alternative options. So Ease is the 24/7 cash plan, 24/7 EAP telephone line. Again, same product. So you have counsellors, you have medical advisors, and you have lawyers on the phone as well. And you also get 6 counselling sessions delivered face-to-face or on the phone. And like the cash plan, you also have access to the Health eHub, which is an online portal giving you access to a wide variety of self-help resources. Another product that we do is Healthy Extras. So Healthy Extras is the next product up. So we almost say that Ease is the base level. It's what you should really have within the workforce. Healthy Extras is a step up, and then your cash plan is a step up from Healthy Extras. So Healthy Extras gives you a little bit more. So it gives you Doctor Line, which is a 24/7 GP surgery. It gives you the 24-hour advice and information telephone line, which is your EAP telephone line. It gives you Together All, which is an online safe space for mental health support. And it also gives you the Westfield Rewards, giving you access to those high street and online retailers. This is just giving you a little bit more information in regards to Doctor Line. So again, you can call when you need to. And as long as you need to. They don't have a 10-minute appointment slot, so you can stay on the phone to them as long as you need them to be on the phone to you. You can discuss health issues, and it is strictly confidential. You do have the option to have Doctor Line not inform your GP surgery if that is the case. They would inform your GP surgery that you have called them unless you stipulate that you don't want them to. You have unlimited usage, so you can call as many times as you need to. And as I've said before, you've got the webcam option there as well if you wanted to have the webcam consultation opposed to the telephone. And then the prescription medication is, they do have a delivery option. They can send it directly to your door, or they can send it to your local pharmacy. We do also have Together All. I've just noticed that there's a typo, so it's meant to be 365, not 265. But Together All is this online mental health support platform. It's fantastic, and we have so much feedback from this platform. And it's basically a peer-to-peer support via an online format. So it's a forum style. All facilitated by counsellors 24/7, so there's no risk of trolling or hate speech, because everything has to be approved by the counsellor before you can use the service. Again, this gives you a bit more information on Westfield Rewards. There is a video that you can watch. It's probably easier to find the videos online, but I can send those through as well, so you can just get a feel for what Westfield Health is. Okay, so we also offer mental health first aid training. So our mental health first aid training is delivered by Mental Health England coaches, and we deliver a few different courses, all again via Mental Health England and via Mental Health England coaches. But the first aid course is a 2-day course, and this gives you access to helping support your people if they have any mental health issues. So the 2-day course is delivered both virtually and face-to-face. If it's virtually, it's split across 4 days because it's a specific section for each day. So you have 2 days in week 1 and 2 days in week 2. Face-to-face, it's just a 2-day course, but you are going through 2 sections on the first day and then again 2 sections on the second day. Every delegate who has or takes part in the mental health first aid course will receive a manual, a full workbook and information resources to support mental health issues. I have done this mental health first aid course and it is fantastic, and I recommend this to all of my businesses that I talk to have a contingency in place. We also offer wellbeing webinars. Now this can be a range of topics. If it's not disclosed on our product insert, which is our information guide of what the wellbeing webinars are, if you want something tailored to you, we can offer that service as well. They're led by experienced wellbeing coaches. Many have years in the industry, and it's a way of increasing the engagement to your people. So to give you an example of what our wellbeing webinars look like, we do various topics. They can be from men's health to women's health. Menopause is an extremely popular one at this moment in time. We do mental health awareness webinars. We do webinars going from mental health right through to physical health, how to get a better night's sleep, how to look after yourself, how to make sure you're eating properly. So we do a wide variety of various different webinars that can be available to you. We also offer something called the annual wellbeing programme, which is a bespoke plan. You create it, but it's a 12-month plan, and it takes into consideration the webinars, but also a health calendar. And the health calendar gives you access to 27 topics, and you pick 12. So you pick a topic a month, and we send you all of the marketing material for your chosen topic every single month, and then you have a webinar as well on top of that. The topics again range from healthy eating to menopause to how to keep your heart healthy, staying well in the sun, various different topics that you can choose from. And we also offer health and lifestyle screening as well. So this is confidential one-to-one appointments with an experienced health coach. And basically it's looking at your overall health and well-being, from your cholesterol, blood pressure, glucose levels to your lifestyle. They'll go into depth with this. You can choose from a 10-minute MOT check to a 15-minute or a 20-minute. So it depends on what you want. And you as a business will receive a report detailing the findings, but it's still confidential, but it will give you an overall finding of what the health and lifestyle is of your people. So I wanted to show you those other benefits because they are the most popular benefits that we're seeing at this moment in time, and a lot of it is because of COVID. COVID has obviously had a large impact on businesses, but also their people. So those benefits, those health and wellbeing services are the ones that we're seeing being utilised the most, because businesses are now wanting to support their workforce with health and lifestyle screening, but also mental health first aid training, because mental health has been massively impacted during the last couple of years. But also making sure that we've got the wellbeing strategy in place going forward. So it's not just getting something in for the day and then don't think about anything else afterwards. So it's a nice way to keep that health and wellbeing strategy going and keep that focus on health and wellbeing moving forward. I'm just going to stop sharing my screen and Jen, I can just answer those questions in regards to the prices. So level 1 for the cash plan starts at £6.13. Level 2 is £12.22. Level 3 is £23.63, and level 4 is £35.30. I will send you all of the information via email, Jen, so you're more than welcome to share this with everybody else in regards to pricing.
And that's per person per month?
Per person per month.
And some of the other bits and pieces there, additional costs around the health and welfare insurance and the screening, everything else like that. Are you able to give us an indication of where the prices start for those for Juliet's benefit?
The prices will differ depending on what it is you want, how large your workforce is. So that's where we would go into a consultation approach. So for all chamber members, I offer a free consultation appointment where we go through the ins and outs of your business. So I find out a bit more about you and your people. The idea of the consultation is to see what you have in place, if you do have something in place, but also what your strategy is going forward. What's your wants, your needs, your musts? What's your 3-month, 6-month, 9-month, 12-month plan look like? What are we looking at after that 12-month period? How can we put something in place to tackle issues that you might see within the workplace if you have any? So the consultation is a really great approach to delve in and have a look at what's the best plan for you. It might be the chamber cash plan, it might be health and wellbeing, it might be all of it together. So there's definitely it's definitely worthwhile having a free consultation. But Juliet, sorry, just to touch upon again the competition. So we split our MRI, CT scans and PET scans away from the consultation benefit, and that's what our competitors don't do. So what that means for you as an employee, from a business perspective, is that if you had the cash plan and you needed to see a consultant privately, you've got your own pot of money to go and see that consultant. Now, if that consultant said you need an MRI scan, you know that you do not have to pay for that appointment. You can call Westfield Health and we will book it and pay for it for you on your behalf. And then if you then needed a follow-up appointment again with the consultation, you can go and have that because you may still have some allowance left. Our competitors don't do that. So any MRI scans, any consultations or any tests are taken from that same pot of money, which is normally lower than what ours would be. So that's one key that we do. Another thing that we do is include our EAPs into our cash plans.
What does that stand for?
Employee Assistance Programme. It's your counselling telephone line.
Okay.
A lot of the competitors remove that from their cash plans and you have to bolt that in. We don't. We keep that into our cash plans. But I think the main thing to take away from this is that we work with the British Chamber of Commerce and we are the sole health and wellbeing provider for the British Chamber of Commerce. And I know that there's another health insurance provider who work with the British Chamber of Commerce that do include cancer and heart treatments. We don't, and we don't because we are there to complement the NHS. We're not there to compete. So what we do is we offer surgery to those that are finding that the NHS wait is just too long. Whereas cancer and heart treatment, you're going to get a reaction. You have a 2-week turnaround. So they have a 2-week KPI to get you seen by a consultant if a cancer is suspected or any heart conditions. So you are seen really, really quickly with the NHS. And we felt by doing our research that we don't need to include those into the plan because then it just puts the premium too high. Then businesses actually won't take it out because it's too costly. So we do that to complement the NHS as opposed to compete against them. But another thing to just make you aware of is that we have no stakeholders. We're a not-for-profit heritage, so we don't have stakeholders, which means that we don't have anyone taking a chunk of any profit that we make, which then allows us to put our profits back into our research programme to make sure that our products are fit for purpose, they're right for people of today. They change with the times. Obviously, COVID's had a massive impact, so we've changed our offering slightly, and that our research has allowed us to do that. But also, we give millions back to the NHS. So we've paid for hospital furniture, we've paid for a new wing, we've paid for cancer cancer ward beds, etc. So we're always giving back to those around us. And we're the main health and wellbeing provider again for the BCC, and we're also the main sponsor for the British Transplant Games. And if you're aware of anyone who's had an organ transplant or donated an organ, they will know about the Transplant Games. It's like the Olympics, but for transplantees.
Wow.
In regards to medication, so they can prescribe, but anything where you need follow-up appointments or continual medication check-ins, they will advise you to go to your GP, because you need that face-to-face support as opposed to what Dr. Line offer. But if you needed antibiotics or painkillers, etc., Dr. Line would be able to do it, and they would update your medical history, so your GP would be able to see what they've done, and obviously your medication will be either delivered to your door or to your local pharmacy. But anything that needs that more long-standing support by way of continual appointments, then realistically it should be your GP that you go and see. They're going to be the best people.
And what about the dental service? How does that work?
So yeah, I noticed that you said dent plan. So we're not a dent plan. You don't pay for a monthly subscription. You literally have your allowance pot of money for your dentist appointments, and it covers everything from checkups, fillings, scales, polishes, x-rays, dentures, orthodontist appointments, you know, everything will be included.
But that service you would still source locally ourselves. So if you already were registered with a dentist, you would continue with that.
Yeah, absolutely.
Sam, can I just quickly ask, am I right in thinking that actually, Julia, you guys could buy the baseline if you wanted the medical cashback side of things, but if an employee knows that they have a lot of opticians appointments, then they can up it to the top level, so they get the most money back on that. If they wanted to, they can add their spouses as well.
Absolutely.
But if they know they got some, they need the dentistry side of things, they themselves can up it to the higher category if they want to. So you can go in at the base level and they can increase it if they feel there's a need.
When is that taken? Is that pre-tax, post-tax, out of their direct from their salary? How does that work?
So in regards to the cash plan itself, the business would pay corporately. So you as your business would pay corporately, and you, again, as Jen said, you can go with level 1 if you wanted to and put everyone on level 1, and then you would pay for that out of the business. And then if the employee wanted to upgrade the level of cover, which they are more than welcome to do so, they would pay via direct debit. So they would set that up themselves, and they can add an additional adult onto the plan as well, which would be done via direct debit.
So we don't have to complicate.
No, it takes
payroll.
the admin away from you, from a business's point of view. It's all done via the employee.
Perfect. Good stuff.
I definitely think it'd be great to get you booked in for a one-to-one, and anyone who's registered for the webinar, for this webinar, I will be following up via email anyway to see if anyone wants to book in for those one-to-ones.
I mean, I would definitely need to get the other guys involved, because otherwise it's going to be a wasted trip for you, but I would certainly be interested, and it's definitely something. I mean, I've been, we've been talking about this for a while, so it would be a good thing definitely to get that extra bit of information.
Brilliant. Well, we'll share the contact details after this, and we'll go from there if that's okay.